World Stroke Day is October 29th, so this is a great opportunity to learn more about how to prevent and treat and beat stroke. Stroke occurs when blood flow to the brain is interrupted. Without the blood carrying oxygen to the brain cells can die. About 2 million brain cells die per minute during a stroke emergency. Stroke is the third leading cause of death in New Jersey and the fifth leading cause of death nationwide, and it is the number one cause of long-term disability in the United States. It is more disabling than it is fatal. For more information about stroke, you can visit www.strokeassociation.org. What are the warning signs or the symptoms of stroke? It is so important that you recognize the signs and symptoms of stroke because the treatment should be initiated immediately. It is important to get treatment fast, F-A-S-T. The acronym FAST stands for face drooping. Does one side of the face appear to droop, or is it numb? Ask the person to smile. Does the person have an uneven smile? A stands for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift down and they're unable to hold it against gravity? Also, S stands for speech difficulty. Is the speech slurred? Is the person unable to find their words or understand speech? If they are unable to speak or if they are hard to understand, ask the person to repeat a simple sentence such as "the sky is blue." If they cannot do this, this could be the sign of a stroke. T stands for time to call 911. If a patient exhibits any of these signs or symptoms, they must get to the nearest stroke facility immediately, and it's time to call 911 to get to the hospital immediately. It is also important to check the time to know when the onset of symptoms occurred. This is because some of our stroke treatments are time sensitive, and we need to know the time they were last seen well. A stroke can happen to anyone at any time, so please share these warning signs with your friends and family members so that everyone can be ready to act in a stroke emergency. It's also important to realize that strokes can be prevented. If we identify and treat stroke risk factors such as diabetes, hypertension, obesity, smoking, 80% of strokes can be prevented. The American Heart Association recommends following Life's Simple 7 to achieve ideal health. That is, to stop smoking, to be physically active, to have a healthy diet, maintain a healthy body weight, to control cholesterol, blood pressure, and blood sugar. High blood pressure is the most common controllable risk factor for stroke. In addition, moderate to vigorous physical activity can reduce the risk of stroke by 25%. The American Heart Association recommends 150 minutes of moderate physical activity per week. So to just recap, stroke is a leading cause of long-term disability in the United States, and it is the fifth leading cause of death in the United States, the third leading cause of death in New Jersey. Most stroke is preventable if we notice the risk factors and treat them prior to having a stroke.